Today in this CME, I am going to tell you the importance of a teacher. Now, how a teacher is different from a conventional book. Now, conventional books, which are of standard level, they tell almost everything, but still they lack in practical part. And that is where the role of the teacher comes into play. At least 50% of the teaching by a teacher in ultrasound should be comprised of the practical part. Things which a person has learned while doing ultrasound and applying brain properly. I remember when I was very new, I had a lot of theoretical knowledge, and I used to think that maximum 1 month or 2 months and I'll be perfect in ultrasound. And then someone told me you require minimum of 6 months, and I was just laughing. 6 months, that's a very long time. Maybe that is applicable to the weaker students, but not to me. That was the impression I had. And finally, I realized later on that even 6 months is nothing. Whatever knowledge I had that time, that was not even 1% of the knowledge which I have right now. And believe me, I'm still learning. There was an article about diagnosis of appendicitis when I just finished my MD, and then subsequently more articles came, and when I was doing ultrasound, I was not able to pick up these cases of appendicitis, even though clinically I knew that they are typical cases of appendicitis. Now, where the books were lacking? None of the books had mentioned that in order to see an appendix, either you require a high frequency probe, or if you are working with a normal 3.5 megahertz probe, which we normally work at around 15 to 18 centimeter depth, you have to reduce the depth somewhere around 7 centimeters or so, because the appendix is superficial and small, even when it is inflamed. And you won't be able to pick up majority of the cases if you work with a 3.5 megahertz probe at a normal depth. So, herein the role of the teacher comes. One of the things I remember, something which was told to me by a clinician, that one person who was doing ultrasound in his clinic missed out on a 7 months pregnancy. Believe me, I wouldn't have believed that person if he was not the person, he was someone else. But I knew that person is not going to lie to me. And then I was just thinking how the person can miss out on a 7 months pregnancy. And the only way I could make out was that since the person was doing portable ultrasound, and portable ultrasound people, they do very fast scanning. So probably the bladder was full. He had put the probe just in the suprapubic region without moving the probe in other areas. And just next to a full bladder, you can see cervix with an empty cavity. And he would have seen that. If he would have just moved the probe up to see the blind end of a uterus, because the uterus, when it is in a non-gravid state and you follow from cervix to the uterus, you can see a blind end. He would have still been able to pick up if he was in this habit. But most of the people, they do ultrasound haphazardly, and this is where they make mistakes. Another incident I tell you, one of my student, a senior gynecologist, she told me about a story that few days back she was getting an ultrasound done at her clinic, and the person who was doing ultrasound showed her all the parts of the uterus, the bladder, and all the lower abdomen part. And then he packed his bag and he left. Now, as he left, she told the patient that everything is fine, your uterus, everything, and axial area, everything is fine. And then the patient told the gynecologist, ma'am, probably you have forgotten. You only did my hysterectomy. And then she was stunned. She went outside, pulled the ultrasoundologist, and brought back to scan again. Now, this situation is not uncommon. It is fairly common. So many times we have seen people reporting as a normal uterus when a hysterectomy has been done. Why? Because they see the ball loops and they confuse that with a uterus. But if they are in the habit of seeing a blind end of the uterus, they won't make such a mistake. Just like this incident, there are so many people who report multiple gallstones when a cholecystectomy has been done. How can you make a mistake? Because you are seeing duodenum with particles, and that is what you are making as a gallbladder. But if again you are in the habit of seeing the blind end of the gallbladder, you will not make such a mistake. So this is what is the job of a teacher. To tell you about things which are not depicted in books or they are not properly mentioned in the books. This is where you can make a difference. A proper knowledge, a proper learning. That's all.